Getting older is a privilege, but it is not always a comfortable journey. Let us be completely honest with each other. As we cross the threshold of 50, and certainly as we move through our 60s and 70s, the human body begins to accumulate wear and tear. You wake up in the morning, swing your legs over the side of the bed, and your knees crack. Your lower back hums with a dull, persistent ache. The arthritis in your fingers makes it difficult to open a tightly sealed jar of coffee. Pain becomes a quiet, unwelcome companion in your daily life. And what is the most natural, deeply ingrained response to that pain? You walk into your bathroom, open the medicine cabinet, and shake 2 or 3 little pills out of a plastic bottle. You swallow them down with a sip of water, and within an hour, the pain fades away. You can go about your day. You can play a round of golf, work in your garden, or get down on the floor to play with your grandchildren. You feel like those little pills have given you your life back. You assume they are perfectly safe because you bought them right off the shelf at your local grocery store, without a prescription, right next to the toothpaste and the vitamins. But what if I told you that the simple, everyday act of swallowing that common painkiller is one of the most dangerous things you can do to your cardiovascular system? What if those exact same pills that silence your aching knees are simultaneously clamping down on the blood vessels in your heart, strangling the blood supply to your kidneys, and actively preparing your body to form a massive, life-threatening blood clot? Every single day, patients arrive in my emergency department suffering from catastrophic heart attacks and sudden, severe spikes in blood pressure. And very often, the trigger was not a heavy meal, and it was not extreme physical exertion. The trigger was the over-the-counter pain medication they took for a sore shoulder 3 days in a row. Today, we are going to expose the hidden, terrifying truth about a class of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. We are going to dive deep into the specific biochemical mechanisms that make these drugs so profoundly toxic to an aging heart, how they completely neutralize your prescribed blood pressure medications, and exactly what you must do to manage your pain safely. Before we begin breaking down the science of these dangerous medications, I must state my standard and most important medical disclaimer. This video is intended strictly for educational purposes. I am a doctor, but I am not your personal physician. The complex mechanisms and medical events we are about to discuss are based on extensive, peer-reviewed scientific literature, but every single human body reacts differently. Do not ever use the information in this video as an excuse to abruptly stop taking any medication that your doctor has explicitly prescribed for you, including prescription painkillers. Quitting certain medications suddenly can trigger severe withdrawal responses or rapid worsening of underlying conditions. Use the knowledge I am sharing with you today to educate yourself, to understand the risks, and to become a powerful advocate for your own health. Then, take this information directly to your primary care provider or your cardiologist and have a serious, informed conversation about the safest way to manage your specific medical profile. To truly understand why a pill meant to fix a bad knee can destroy a healthy heart, we have to understand the invisible chemical communication system inside your body. When you twist your ankle, or when the cartilage in your knee wears down from decades of use, your body responds by triggering inflammation. Inflammation is your immune system's way of rushing blood, fluid, and healing cells to the site of an injury. But inflammation also causes swelling, redness, and significant pain. The primary chemicals responsible for creating this pain and swelling are called prostaglandins. Your body manufactures these prostaglandins using a very specific pair of enzymes known as cyclooxygenase 1 and cyclooxygenase 2. In the medical field, we simply call them the COX-1 and COX-2 enzymes. When you take a non-steroidal anti-inflammatory drug, whether it is ibuprofen, which is sold under brand names like Advil or Motrin, or naproxen, which is sold as Aleve, or even prescription NSAIDs like diclofenac or celecoxib, the drug enters your bloodstream and begins hunting for these COX enzymes. The drug's entire job is to block these enzymes from working. By shutting down the COX enzymes, the drug completely halts the production of prostaglandins. Without prostaglandins, the inflammation recedes, the swelling goes down, and the pain signals traveling to your brain are silenced. You feel better. It seems like a brilliant, perfect solution. But here is the devastating catch that the pharmaceutical commercials never mention. Prostaglandins do not just cause pain in your joints. They serve incredibly vital, life-sustaining functions throughout your entire cardiovascular system. Prostaglandins are the chemical messengers that tell the smooth muscles lining your blood vessels to relax, stay wide open, and allow blood to flow freely. They are the chemical messengers that protect the delicate inner lining of your stomach from being eaten away by your own digestive acids. And they are the primary chemical signals that tell your kidneys to filter out toxins and release excess water into your urine. When you swallow that ibuprofen to stop your knee from hurting, the drug does not just go to your knee. It floods your entire circulatory system. It goes to your heart, it goes to your brain, and it goes to your kidneys. And it brutally shuts down prostaglandin production everywhere. Let us look at the immediate impact this has on your blood pressure. As an adult over the age of 60, your blood vessels are naturally a little bit stiffer than they were when you were 20. They rely heavily on those relaxing prostaglandins to stay dilated so your heart does not have to work too hard to push blood through them. When you take an NSAID, you strip your blood vessels of that relaxing chemical. The immediate physiological result is that the blood vessels clamp down. They constrict. The pipes become narrower. Because the pipes are narrower, your heart has to suddenly pump with significantly more force just to keep your blood circulating. This causes an immediate, dangerous spike in your blood pressure. I want to tell you about a patient I will call Arthur. Arthur was 72 years old, a retired mechanic who spent his days woodworking in his garage. Arthur had a mild case of high blood pressure, but he managed it perfectly with a daily dose of lisinopril, which is an ACE inhibitor. His blood pressure was consistently stable at 125/80. One autumn, Arthur developed a severe flare-up of osteoarthritis in his right shoulder. It was keeping him awake at night. Rather than going to the doctor, he went to the pharmacy and bought a large bottle of maximum-strength ibuprofen. He started taking 800 milligrams, 3 times a day, just to dull the pain enough to work in his shop. 2 weeks later, Arthur woke up with a horrific pounding headache right behind his eyes. He felt a tight squeezing sensation in the center of his chest. His wife, terrified, called for an ambulance. When Arthur arrived in my emergency department, his blood pressure was a staggering 190/110. He was in the middle of a hypertensive crisis, and his heart muscle was straining under the immense pressure. The excessive doses of ibuprofen had completely neutralized his prescribed blood pressure medication. The ibuprofen had clamped his arteries shut, overriding the relaxing effects of the lisinopril. Arthur had not missed a single dose of his heart medication, but the painkiller he bought at the grocery store had rendered it completely useless. We had to administer intravenous drugs to forcefully bring his blood pressure down and prevent a stroke. Arthur survived, but he caused permanent microscopic damage to his blood vessels, all because he was trying to treat a sore shoulder. Arthur survived, but he caused permanent microscopic damage to his blood vessels, all because he was trying to treat a sore shoulder. This brings me to a critical point I need every senior watching this to understand. If you are taking any medication to control your blood pressure, whether it is a beta blocker, an ACE inhibitor, an angiotensin receptor blocker, or a diuretic, taking a non-steroidal anti-inflammatory drug is like stepping on the gas pedal and the brake pedal of a car at the exact same time. The NSAID actively fights against the life-saving prescription drug. It is a pharmaceutical tug-of-war happening inside your arteries, and very often the painkiller wins, leaving you completely unprotected against a sudden stroke. I am not telling you to stop any medication, but you must discuss this dangerous interaction with your doctor. But the danger of these pain pills does not stop at your blood pressure. The second, and perhaps even more terrifying mechanism, involves your kidneys. Your kidneys are magnificent, highly complex filtration machines. They receive roughly 20% of all the blood pumped by your heart every single minute. In order to filter that blood, clean out the toxins, and turn the excess fluid into urine, the kidneys require a massive, high-pressure flow of blood entering them. The blood vessel that brings blood into the filtering units of the kidney is called the afferent arteriole. To keep this vital blood vessel wide open, the kidneys constantly pump out massive amounts of, you guessed it, prostaglandins. When you take an NSAID like naproxen or diclofenac, you block the production of those renal prostaglandins. The afferent arteriole bringing blood to the kidney instantly constricts. It squeezes shut. The blood supply to your kidney is suddenly choked off. When your kidneys sense that their blood supply is dropping, they panic. They assume that you must be bleeding to death somewhere, or that you are severely dehydrated. In response to this perceived emergency, the kidneys shut down urine production. They begin to aggressively hold on to every single drop of water and every single grain of sodium in your body. This is a condition called fluid retention, or edema. For a young, perfectly healthy person, retaining a little bit of fluid for a day or two is not a major issue. But for a senior, particularly a senior with any underlying weakness in their heart muscle, sudden fluid retention is incredibly dangerous. All of that extra water gets dumped directly into your bloodstream. Your total blood volume dramatically expands. Now, your heart, which might already be struggling against high blood pressure, suddenly has to pump a massive, heavy volume of fluid through constricted pipes. The heart muscle stretches, it strains, and it eventually begins to fail. The fluid then backs up into your lungs, causing you to drown in your own body fluids. This is called congestive heart failure. A massive, incredibly important study published in the British Medical Journal investigated this exact link. The researchers analyzed the medical records of nearly 10 million patients. They found that taking any non-steroidal anti-inflammatory drug, even over-the-counter ibuprofen, increased the risk of being hospitalized for acute heart failure by an astonishing 19%. The risk was even higher for seniors who took the medications daily or at high doses. The painkillers were literally overwhelming their hearts with retained fluid. Let me share the story of Evelyn. Evelyn was 68, a former librarian who loved to take long walks in the park. She had a history of mild heart disease but was doing very well on her medications. One spring, Evelyn developed terrible plantar fasciitis, a very painful inflammation of the heel. Her podiatrist suggested she take naproxen twice a day to reduce the inflammation. Evelyn followed the advice diligently. About 10 days later, Evelyn noticed that her favorite walking shoes felt incredibly tight. By the next evening, her ankles were so swollen that her skin looked shiny and stretched. When she laid down to go to sleep, she suddenly felt like she was suffocating. She had to prop herself up on 4 pillows just to catch a breath. Evelyn was rushed to the hospital in the middle of the night. Her lungs were filling with fluid. The naproxen she was taking for her foot had constricted the blood flow to her kidneys. Her kidneys had shut down their filtering process and hoarded massive amounts of fluid, which overloaded her fragile heart and backed up into her lungs. It took 4 days in the cardiac intensive care unit, receiving massive doses of intravenous diuretics, to pull the excess fluid out of her lungs and save her life. Evelyn's story is a textbook example of how a drug meant for a local pain problem can cause systemic, life-threatening cardiovascular failure. Now, we must discuss the third and most immediately fatal risk associated with these medications: blood clots and heart attacks. To understand this, we have to look closely at the tiny cells in your blood called platelets. Platelets are responsible for clumping together and forming clots to stop you from bleeding when you get a cut. In a healthy cardiovascular system, there is a very delicate, perfect chemical balance that keeps these platelets flowing smoothly without sticking together when they shouldn't. This balance is maintained by 2 competing chemicals. One is called thromboxane, which tells the platelets to get sticky and form a clot. The other is called prostacyclin, which tells the platelets to stay slippery and avoid clotting. Prostacyclin is, unfortunately, a type of prostaglandin. When you take certain NSAIDs, the drug disproportionately blocks the production of the slippery prostacyclin, but leaves the sticky thromboxane completely unchecked. You are entirely destroying the balance of your blood. You are removing the chemical brakes that prevent clotting, while leaving the accelerator pressed down to the floor. Your blood becomes hypercoagulable. It desperately wants to clot. If you are a senior who already has some microscopic cholesterol plaque built up inside the arteries of your heart, this sticky blood is a ticking time bomb. The sticky platelets will latch onto that plaque, rapidly form a massive clot, and completely block the artery. The oxygen supply to your heart muscle is instantly severed. This is a massive myocardial infarction, a heart attack. The European Heart Journal published a groundbreaking study analyzing the cardiovascular risks of diclofenac, a very popular prescription NSAID used for arthritis. The researchers concluded that taking diclofenac significantly increased the rate of major adverse cardiovascular events, including fatal heart attacks and strokes, within just 30 days of starting the medication. Let me repeat that. Within just 30 days. You do not have to take these drugs for a decade to suffer the consequences. The chemical imbalance in your blood happens almost immediately. I had a patient named Richard, a vibrant 75-year-old man who played golf 3 times a week. Richard had a minor history of angina, which is chest pain caused by slightly narrowed arteries, but he had never had a full heart attack. Richard hurt his lower back swinging a golf club. His friend told him to take a prescription-strength dose of ibuprofen to knock out the pain. Richard took 800 milligrams every morning before hitting the golf course. On the 4th day, on the 7th hole, Richard collapsed in the middle of the fairway. He suffered a massive widowmaker heart attack. The ibuprofen had shifted his blood chemistry, making his platelets incredibly sticky. A small, previously stable plaque in his coronary artery became the anchoring point for a sudden, massive blood clot. We were able to stent his artery and save his life, but a significant portion of his heart muscle died that day on the golf course. Richard thought he was just treating a pulled muscle. He had no idea he was chemically programming his blood to clot. We also have to talk about a phenomenon known in the medical world as the triple whammy. This is a specific, deadly combination of medications that causes acute kidney failure, and it happens to seniors all the time. The triple whammy consists of 3 drugs taken together: an ACE inhibitor or an ARB for blood pressure, a diuretic water pill, and an NSAID painkiller. If you take a diuretic, it reduces your blood volume. If you take an ACE inhibitor, it dilates the blood vessel, leaving the kidney. Both of these actions lower the pressure inside the kidney. Under normal circumstances, the kidney handles this by using prostaglandins to dilate the blood vessel entering the kidney, ensuring enough blood still flows through. But if you add the third drug, the NSAID painkiller, you block the prostaglandins. The entry vessel slams shut. The pressure inside the filtering unit of the kidney drops to zero. The kidney completely dies. It stops filtering entirely. Toxins rapidly build up in the blood, leading to a fatal cardiac arrhythmia. A study in the Journal of the American Medical Association highlighted that seniors taking blood pressure medications who casually add an over-the-counter NSAID for pain are at a massively elevated risk of suffering this triple whammy acute kidney injury. It is a silent chemical catastrophe happening right in your medicine cabinet. I know this information is frightening. I know that chronic pain is exhausting and debilitating. You might be sitting there thinking, well, Dr. Okoro, if I can't take ibuprofen, and I can't take naproxen, what am I supposed to do? Am I just supposed to suffer in pain for the rest of my life? Absolutely not. Managing pain is a critical part of healthy aging, but we have to manage it smartly, without destroying your heart in the process. I have developed a specific, actionable guide to help you navigate this. I call it the Heart-Safe Pain Relief Checklist. These are 5 concrete steps you can take to manage your joint and muscle pain while fiercely protecting your cardiovascular system. Step 1. The acetaminophen trial. Acetaminophen, widely known by the brand name Tylenol, is not an NSAID. It works through a completely different pathway in the central nervous system. It does not block prostaglandins in the rest of your body, meaning it does not spike your blood pressure, it does not harm your kidneys, and it does not cause blood clots. For mild to moderate arthritis or muscle pain, acetaminophen should always be your absolute first line of defense. However, you must be careful not to exceed the daily recommended limit, usually 3,000 milligrams for seniors, because excessive acetaminophen can damage your liver. But for your heart, it is vastly safer than an NSAID. Step 2. The topical transition. If your pain is localized to a specific joint, like a single bad knee, a sore elbow, or arthritic knuckles, do not swallow a pill that affects your entire body. Instead, use topical treatments. You can get prescription gels like diclofenac gel or over-the-counter creams containing lidocaine, menthol, or capsaicin. When you rub a gel directly onto a sore knee, the medication penetrates the tissue locally to stop the pain, but very little of the chemical actually enters your deep systemic bloodstream. This provides excellent pain relief while sparing your heart and your kidneys from the toxic side effects. Step 3. The pharmacy audit. Go into your bathroom right now and gather every single box and bottle of pain medication you own. Read the active ingredients carefully. If you see the words ibuprofen, naproxen, diclofenac, celecoxib, meloxicam, or aspirin, unless the aspirin is specifically prescribed by your cardiologist in a low dose for your heart, you need to put those bottles in a separate bag. Take that bag to your next doctor's appointment. Tell your doctor, I watched a video about the cardiovascular risks of these drugs. Can we review these and find a safer alternative for my pain? Step 4. The 3-day rule. There may be rare occasions where your doctor determines that a short course of an NSAID is necessary for a severe acute injury. If your doctor explicitly prescribes it, follow their instructions. But the golden rule for seniors is to use the lowest possible dose for the absolute shortest possible time. Never take an over-the-counter NSAID for more than 3 consecutive days without consulting a medical professional. The risk of heart failure and kidney damage multiplies exponentially the longer the drug stays in your system. Step 5. Physical interventions. We rely too heavily on chemicals to solve mechanical problems. If you have osteoarthritis in your knees, the most effective long-term treatment is not a pill. It is physical therapy to strengthen the muscles around the joint. It is gentle, low-impact movement like swimming or stationary cycling to keep the joint lubricated. It is using heat therapy in the morning to loosen stiff joints and ice therapy in the evening to reduce inflammation. Work with a physical therapist to develop a mechanical solution to your mechanical pain. Your heart has beaten tirelessly for you for over 60 years. It is a resilient, miraculous organ, but it cannot withstand the silent chemical assaults caused by common pain medications. You have the power to stop this damage right now. You do not have to be a victim of the pharmacy aisle. Be curious, read the labels, and never put a chemical into your body without understanding exactly what it does to your heart. I strongly encourage you to share this video immediately. Send it to your spouse, email it to your friends from the golf course, or share it with your family members. Almost everyone has a bottle of ibuprofen in their house, and almost no one over the age of 60 realizes they are holding a potential heart attack in the palm of their hand. You could easily save a life today just by passing this knowledge along. If you found this deep dive into medication safety valuable, and you want to continue learning how to fiercely protect your health as you age, please hit the subscribe button and tap the notification bell. My goal is to decode the complex medical science and bring you the unvarnished truth every single week. Before you close this video, please leave a comment down below. Tell me, what is your go-to method for dealing with morning joint pain or a stiff back, and have you ever checked if it is safe for your heart? I read as many comments as I can, and your personal stories help me understand exactly what kind of guidance this community needs. Use the information I have shared today as a starting point for a conversation with your healthcare team, not as a replacement for them. Bring this up at your next appointment. Thank you for your time. Take care of your heart. It is the only one you have got, and I will see you in the next video.